everybody, it's Alex Kelly. I'm here with Dr. House Stewart, the CEO and co-founder of the Stewart Center for Minimally Invasive Dental Medicine in Flower Mound, Texas. How are you doing this evening,
Great,
Dr.
thanks
Stewart?
Alex, thank you. Good to see you guys, and I'm glad you're here with us.
Yes, all right, so let's just start right at it, Dr. Stewart. So tell me, what prompted you to found the Stewart Center?
Well, my dear friend, Dr. Craig Harry, who, by the way, is the second vice president of the American Dental Association, very proud of him. He got voted in at the last ADA meeting in 2018. He practices in Leawood, Kansas, and he and I had both gone through some extensive training on biologic dentistry. And in 2012, we started talking about having this vision of a teaching center that encompasses a type of dentistry that relates the mouth to the rest of the body, because it's all connected. And we've seen frustration with dentists throughout the years in cases that fail, not being able to help patients that have really debilitating issues with TMJ issues and their teeth wearing down. At about the same time that Dr. Harry and I started having this idea of having a teaching center, sleep breathing disorders were starting to be more coming up more and more in the profession. And as it has evolved, we found that the sleep breathing disorders are connected to TMJ issues and the need for full mouth rehabilitation in so many patients. So we decided in 2012 that we were going to found a company, and at that time it was the Texas Center for Occlusal Studies. And we organized a very detailed curriculum that would take a dentist from initial exam and diagnosis all the way through the restorative process at stable condylar position. We'll get into more of that later, I'm sure. And so we had our first class in 2014. We had an incredible, at the time, the program was in two sections. The first section was jaw stabilization. It was a completely standalone program. And then we went from that to those doctors then that wanted to move forward would go into the restorative part of the program. We found very quickly that doing that in two different types of programs it just made more sense to put it together into one, because if you went through and you learned how to stabilize the TMJ and get rid of all the TMJ symptoms, but then didn't know how to move forward from there, what good would that really do you? Yeah. So we decided in 2015 to put together a curriculum which would encompass a one-of-a-kind curriculum, which would encompass joint stabilization, airway, restoration, being able to diagnose from the inside out, being able to explain to the patient where they are, why they're there, and give them a step-by-step plan to get healthy again. And at that point, we changed our curriculum to a one-year residency program that incorporates all of that. And it's the only residency program like that in the country. There's no other program like this out there. Last year, Craig, with his duties with the ADA, decided that, hey, I still want to teach, and Dr. Craig Harry is an exceptional educator. He's wonderful, and I'm so blessed to have him on board, along with Dr. John Sweeney and Dr. John Korleski, our staff members or faculty members, and of course our airway expert, world-renowned expert, Dr. Mary Burns in Pennsylvania. We've just got this incredible faculty, and we decided to create the one-year program. And we, at the same time, I took over completely as the CEO of the company, and at that point we rebranded. It is now the Stewart Center, and that's what it's going to be for many, many years to come.
Yep, great. Well, you kind of covered this, but if you could just sum it all up, what is the mission, the purpose of the Stewart Center?
The mission of the Stewart Center is to, number one, be an integral part of eradicating sleep-breathing disorders in this country. Well, worldwide, because we do have an international following now, which I think maybe we'll talk about later, to eradicate sleep-breathing disorders, sleep apnea, snoring, upper airway resistance. All with these conditions have horrible or significant comorbidities. So to eradicate that, our primary goal is for the patient, to give patients an opportunity to be with a dentist that's thinking about the whole system and that puts a team together for their betterment. Also, with our mission statement is to help dentists. I love this profession. I see so many dentists out there struggling, and they don't have to. This type of dentistry will help dentists do the type of dentistry that significantly affects patients' lives, not just their mouth, but their whole life and that of their families. And they can do it in an environment where they're not subjected to insurance. They're insurance independent, and it's fee for service, and it's low volume. It's a very calm atmosphere in a biorejuvenation practice. It's not hectic. You're not seeing 50 patients a day. You're not seeing 20 patients a day. You're not seeing 10 patients a day. Maybe 5 to 6 patients a day. And it's also very profitable. The dentists that go through our program spend a lot of time and money, and they're very highly educated. They deserve to get paid. And there are patients out there that are very willing to pay for the best, the ones that want the best value for their money. And so our mission is threefold: to eradicate sleep-breathing disorders, to give patients the very best treatment that can possibly be given by a dentist, and third, but certainly not any less important, to help dentists create the practice of their dreams and have a life that they deserve to have, so they can have time with their families and still make a great living and not be burdened down by the constraints that insurance puts on the practice.
Yeah, that's huge.
Yeah, it is.
So how does the Stewart Center impact dentists' practices and ultimately their lives? You covered this a little bit, but
well, just briefly, what we see now, we're now into our 5th year of this. So we've had we're on our 6th or 7th graduating class now. We see our graduates completely changing their practices. They're going from a insurance-dependent, high-volume practice to one that's more low volume, where they're developing relationships with their patients, and they're teaching their patients. They're becoming their advocates for health. And so what it does, bottom line, is what we're seeing is that they're more profitable. They're enjoying what they're doing. They're insurance independent, and they are doing something significant that they never ever thought they would be doing when they went to dental school. And we work very closely with the medical community, and we biorejuvenation dentists quickly become known as specialists in whole health, whole body dentistry.
Great. So how does becoming a biorejuvenation dentist set that dentist apart? Obviously, it changes their lives, it changes their patients' lives, their practice lives, but you go down the street and in 5 miles you see 15 dentists. How does biorejuvenation dentistry set that dentist apart from the others?
That's a great question. And Flower Mound, Texas, just north of Dallas, just north of DFW Airport, We are a fast-growing community, a very wealthy community. We have a dentist on every corner. There are around 50 dentists in a 2-mile circumference around my office. There's right at 50, a little bit more than 50 dentists. So what sets me apart is that I can handle any of the cases that come in there, that come into my office. I get a lot of referrals from other dentists because what dental school does, and this is I'm not disparaging anyone, dental school teaches us how to fix teeth and become tooth mechanics. And, there may be some new dental schools out there or maybe some changes in curriculum that are changing that, but I lecture all over the country. I lecture worldwide, and what I see is dental schools teach dentists to become mechanics, and it's almost as if this part of the body has no effect on the rest. And I've always thought that is absolutely the most ludicrous thing that you could ever think of, because it's all the same body. Abscessed tooth can kill somebody. There are societies in ancient societies where the archaeologists and the anthropologists have studied skulls, and they see a lot of these people died from infections in the brain from abscessed teeth. So this is what we do is extremely important. So what sets us a BioRejuvenation dentist apart is that we're first of all, when a patient comes in our office, the first thing we ask is not what insurance do you have, but it's how you doing? Where are you from? Are you new to the area? We look at people as people. If a patient wants to do only what insurance will pay for, then they need to go to another dentist. And there's a lot of really good dentists out there that do that. And that's great. If, the world needs Walmarts, the world needs Macy's, the world needs Nordstrom's, and the world needs Neiman Marcus. And there's a dentist out there for everybody. Yeah. We're geared towards the patients that want to significantly impact their health. And that's what sets us apart.
And like you say, there's no case that you'll turn down that you can't do.
Right. What the doctors that come through our program, what they learn is they develop the confidence in treating any case there. Doesn't mean they do it on their own.
Right.
I know when I need to bring in a pulmonologist. I know when I need to bring in a chiropractor. I know when I need to bring in a myofunctional therapist.
Right.
I know when I need to bring in an orthodontist, a maxillofacial surgeon. You learn all that and you start developing a team. I have a team right now that's just fabulous. I have a orthodontist that I refer to. He's the only orthodontist I refer to because he's the best. I have an oral surgeon I refer to for implants. I have another oral surgeon I refer to that does maxillofacial surgery if the patient needs that. I have an incredible neurologist as part of my team, myofunctional therapist, physical therapist, chiropractor. I'm the quarterback, and I have an offensive line, I have a tight end, I have a wide receiver, I have running backs, I have a fullback, but I quarterback the whole thing. And that's what a BioRejuvenation dentist does. We train that doctor to become the quarterback of the team.
Right.
And they can't learn everything. So that's where they say, okay, I need Dr. Orthodontist, I need you to come in here and we see eye to eye on this philosophy. I need you to help this patient in this way, with the ultimate goal being a very, very stable occlusion, TMJ, that supports a healthy airway. So it takes a team. And a BioRejuvenation dentist becomes the quarterback of that team.
Yeah.
That's the most important part that we can play.
Yeah. Because
a lot of the cases that I do, the part that I actually do from a standpoint of doing dentistry per se, is at the end of that's usually the last thing that needs to be done. And but someone has to see it all the way through. Just like if you're building a house, you have a general contractor. That general contractor hires plumbers, electricians, a floor company, painters, foundation, but he or she oversees that whole process. That's what a biorejuvenation dentist does.
Yeah. So obviously, in order to achieve that, there's a lot to know, a lot to learn. So let's say you're a new resident, you're about to start your residency at the Stewart Center. What can you expect to learn?
The first thing you can expect is to be completely blown away after your first weekend. Yeah. You will go back to your office, and I'm not saying this facetiously because we get this from pretty much 100% of our residents. They go back to their office on Monday and they're seeing everything in a whole new light. And that's just after the first session. So what you can expect is to have the most comprehensive, thorough, that's kind of a redundant term, but the most comprehensive education that's out there. And if there's somebody out there teaching something incredible about how to do composites that are the most beautiful composites you've ever seen, we will find out about that, and we'll bring them in and teach our doctors that as well. Because biorejuvenation dentistry is a philosophy, it's a technique, it's biology, it's science, it's artistic, and it's something that will actually make you a very well-rounded expert in a lot of categories, and give you the knowledge to put together a team that can accomplish incredible things that you could never accomplish on your own as just a general dentist.
Right. So how has biorejuvenation dentistry impacted the lives of your patients, and from all of the graduates you talk with, how has biorejuvenation dentistry impacted the lives of patients of our graduates?
Yeah, well, my patients, our graduates' patients, we get testimonials all the time that these patients are finally feeling good. They feel healthy. They feel rejuvenated. Their airway has been addressed. So, you can do all the most beautiful dentistry in the world, and someone has an airway issue, they're still dying a slow death. Yeah. So our patients, the patients of our graduates, are commenting and giving testimonials about the fact that they were able to have their TMJ bite issues taken care of. Maybe an airway issue that they never knew they had was identified, and they had that treated or taken care of, and they're feeling rejuvenation. They're feeling rejuvenated. That's why I thought the term, when I coined that term 5 or 6 years ago, a biorejuvenation. We're using biology to rejuvenate, to do genetically what our genes want us to do, but there are epigenetic factors that, small jaws, people that have airway issues that prevent that from happening. So we turn all that around. That's in a nutshell what the patients experience. Yeah. And one other thing, the way that biorejuvenation dentistry is done is that we don't start treating a patient, we don't start doing invasive type dentistry until that relationship has been established, that trust has been established. And on top of that, when I say invasive, this biorejuvenation dentistry, one of the definitions, if I would make a definition of that, is that it's conservative. Very rarely do we grind teeth down. Very rarely do we do crowns. We build everything up in composite. It's very, very conservative. So there's nothing that's invasive about what we do. It's very minimally invasive, or oftentimes non-invasive.
Yeah. So the Stewart Center gives dentists skills that free them from being dependent on third-party insurance companies. Can you expound on that a little bit?
My good friend Mike Schuster, who's been in practice coaching dentists and helping them with the business side of the dentistry for close to 40 years now. He just retired last year, well-deserved retirement. And I know Mike's doing great and enjoying life. I don't see him being retired completely because he's just not, that's not his makeup. So if you're watching Mike, hi, how you doing? But Mike has, from the beginning, I started learning from Mike in 1993, 3 years out of out of dental school. And Mike goes back to the first dental insurance company that came out. I believe it was, I can't remember the company, but the benefits were, I think, $1,500 a month, and that was in 1961, 62. Well, in 1961, 62, $1,500 a month or $1,500 a year would, pay for 4 or 5 crowns.
Yeah.
But the average payout for dental insurance now, almost 50 years later, is still $1,500. In my community, 1 crown from a good quality dentist is anywhere from $1,200 to $2,000.
Yeah.
So it's such a dichotomy, and the insurance companies are making a killing. They're very profitable. All you have to do is look at what the CEOs of the insurance companies make.
Yeah.
It's, they make multi-million dollars a year, and that's great. I'm not disparaging them at all. What I do have an issue with is insurance companies coming up with terms like UCR, usual and customary fees. That's just because it's usual, just because it's customary and reasonable. UCR, usual, customary, and reasonable. Well, who's the person that deemed this fee reasonable?
Yeah.
I guarantee you that person was a CEO of an insurance company.
Yeah.
Because reasonable to them is a fee that they can pay out and still make a big profit. So, dentistry did it to itself. We bought into the insurance before 1960, whenever that was. I think it was the United Auto Workers. They were the first company that had or the first organization that had their own organized dental insurance. But before that, patients came in, the dentist did the treatment. A lot of dentists did gold restorations, which are, state of the art at the time, and the patients would pay for it.
Right.
When the insurance came in, it contaminated everything, and it drove a wedge between the practitioner and the patient. And the same thing has happened in medicine. So what we teach BioRejuvenation dentists is to get away from all of that, and you work for the patient pays you, and there's a lot of patients out there who will happily pay the appropriate fee for having the absolute very best dentistry that they can have.
Yeah. Okay, I have a really good quote from Dr. Craig Harry that I want to read to you. He said, "The Stewart Center is growing from infancy, and we are different. We are moving in a direction of holistic, whole body dentistry that is fee-for-service and life-changing."
Yep.
So my question for you is, now that the Stewart Center is gaining critical mass, what do you think is the future for the curriculum and for the vision of the center?
Our center will the curriculum will change every year because, the basic foundation of it will be there. But Dr. Harry, myself, now we have residents out there that are really getting into the airway, and they feed us information. We as a group are growing. We're going to continue to be on the cutting edge of not only technology, but the studies in biology and what's going on with airway. We keep a really close watch on dental materials, which ironically, the materials we use in biorejuvenation dentistry are really inconsequential. It's the philosophy, the way we set up the cases. The materials are they're, I don't want to say they're inconsequential, but they're not the end all be all.
Yeah.
So we want something that is as close to enamel as you can get, both aesthetically and with all the other characteristics and qualities. And we found that composite, there's nothing better than composite resin for that.
Yeah.
So we will continue to be on the cutting edge. We're going to continue to keep our classes small. That is so important in what we do and how we do it, is one-on-one, hands-on with a master. When I say a master, I'm talking about doctors like Dr. Craig Harry, like myself, like Dr. John Korleski now, that's been doing this now for 3 or 4 years. He's done a lot of cases. Dr. John Sweeney. We have other doctors out there. Dr. Bernie Villadiego out in Los Angeles, who's very well known for his photography expertise. He's learned his occlusal philosophy from us. He went through our inaugural class, and they're all changing the world.
Yeah.
So we are. We've hit critical mass in that we're developing a name. You'll never see us filling a class with 200 people. That's not going to happen, not as long as I'm the CEO. It's always going to be small, hands-on. It's not cheap, but the return on investment is unbelievable. It's the most incredible investment that a dentist could ever make in their career.
Yeah. And that's been said by our residents. If you go to our page, you can watch Dr. Will Yoder's testimonial. He talks about that. So that's definitely
just in
accurate.
our class last month, 2 of the residents came up and said, this was their second session. They said, you guys, you don't charge enough for this. This is, for the education we're getting, it's amazing.
Yeah.
So
yeah, it is. Great. Well, we are running out of time, but I want to make sure to get to some of the questions that were sent into us. If we don't get to every single one, we will make sure to go out to you guys and message you. But these were some of the more common ones that I saw. Number 1, somebody asked, do you provide training for staff members?
Yes, that's a great question. Yes, we do. So for our current residents or any past resident, any of our alumni, we have at least once a year, usually twice a year, we have auxiliary training. So it's a 2-day course, Friday and Saturday. The doctor sends their auxiliaries out, and the doctors can't come. They're not allowed. They can travel with their team, but they got to go out and play golf or whatever. And what we do is we train the staff to support the biorejuvenation dentist, and that is so important. So I mentioned a team earlier, a team of surgeon, a neurologist, a pulmonologist, maxillofacial surgeon, an orthodontist, et cetera, et cetera. The most important team is that those people in your office every single day. And we've had now, at least 10 auxiliary weekends. And one thing that we get from, hands down, the doctors comment that my team came back a completely different team. They're on fire, they're ready to go. So it's like any of you out there that have had kids, that Mrs. Smith, their 3rd grade teacher, can teach them how to do math. And when they come home, if you learned a different way and you say, well, this way may be better, it doesn't matter. Mrs. Smith says it's this way, and this is the way it's got to be. So when we know how to train a staff and get them excited to help their doctor, and that ultimately is what we want to do, is to create teams that then can go out and do this type of dentistry to the most efficient manner they can.
Right, definitely. So another question we had is your program, is the Stewart Center open to doctors outside of the United States?
Absolutely. We have doctors from right now. Well, in our current class right now, we have a doctor from Vietnam. He comes in, and that's not an easy route.
No.
It's not like he's coming in from Canada.
Yeah.
So yes, our curriculum is open to any dentist worldwide that's willing to learn.
Yeah.
Yeah.
Definitely. And I see Mary Sloan has joined us. Hi, Mary.
Hey, Mary.
All right.
Mary is one of our BioRejuvenation lab technicians,
Yeah.
and she's excellent. So
Yes.
she's one of the technicians that helps train our doctors and our lab technicians that want to go through our program as well. And by the way, I don't know if anybody's going to bring that up in questions. So we have several questions, but we do train laboratory technicians.
Yes, we do.
And that because what we do is so specific that the lab technician, not any lab technician can do this. So we do train lab technicians as well.
Okay, so the next question is, are the full mouth composites used in biorejuvenation dentistry considered to be temporary or long-term?
Well, I would say this. I've been doing this for 20 years, and I have patients now that I see, on every 6 months that have the composites I did 20 years ago when I was just starting this, that are holding up well. So I would say you could consider the composites to be long-term, not just temporary, because it's when you stabilize the joint and you address the airway and you put the proper form of the teeth, the proper form of the occluded dentition, and you know how the system works, composite works beautifully. Yeah.
Yeah. All right, so somebody said, I don't know anything about occlusion or TMJ therapy. Do you recommend any courses to take as a prerequisite before coming to the Stewart Center?
Yeah, no. I mean, there's no requirement. As a matter of fact, if you haven't had any occlusal training, then that's great. Your brain is an open sponge. We have... And I'm very honored and humbled by the fact that we have doctors that come through our program that are mentors at some of the other major teaching institutes in the United States. They come through our program and we hear this over and over and over again. I've been through X, Y, Z. I'm not going to name any names, but the dentists out there, they knew what I'm talking about. And those are all great places, but none of them present an entire curriculum that takes you from the beginning all the way through initial diagnosis, joint stabilization, identifying the airway issue, how we're going to create an occlusion that supports a healthy airway and a healthy airway that supports the occlusion. It's all tied together, and then takes you all the way through until the final case is done, and also teaches you how to work with a maxillofacial surgeon, how to communicate with your orthodontist, how to put together a team. That's what we do. And for the dentists that want to do significant dentistry as our patients get older, and as more and more and more people are into wholeness and wellness, there's people out there just searching this type of dentistry out.
Yeah. Great. Well, this is the last question that I...
I'm sorry, wrap up.
Yeah.
We have, in our current class right now, we have students that range from 30, I'm trying to think how old she is. She's about 32, 33. Well, our student from Vietnam, I think he's the youngest. He's 30, 31, all the way up into their late 60s. So dentists from absolutely no experience to dentists that have been through, all the places out there that you can go. And they come here and they're learning something brand new and they're all kind of on an equal playing field. So it's for anybody.
Yeah.
And I would recommend, why waste your money and time going to all these other places? Come hear this first, get the foundation, get the knowledge, and then if you want to go to, the West Coast, the East Coast, to the Miami area, whatever, and kind of hear what they have, and maybe pick up some things. great. You get it all here.
Yeah, I know Dr. Chris Hansen, he's another great testimonial for you guys to watch. He said, don't wait until you're, old. Do it now. Do it now. Don't wait.
Exactly.
Okay, well, the last question that we have, again, if we didn't get to your question, we'll make sure to reach out to you.
There's a whole lot more up there, but I guess that's got to be the last one.
Yeah, it's a long one.
You're running out of time. Okay.
So how many graduates of the Stewart Center are really doing what you teach at the Stewart Center, and how does this compare to dentists who have done postgraduate training at other well-known training centers?
That's a great question, and I'm glad that this doctor asked this question. Dr. Mike Schuster I talked to earlier, he's very good friends with the CEOs and the clinical instructors at the major four, Coyce, Pankey, Spear, and Dawson. After having very intimate conversations with them, the best they could come up with, and I won't say which one it was about 5% of their doctors are actually doing this on a daily basis. Since BioRejuvenation Dentistry is so involved with having a lab technician that's trained, there are very few lab technicians that are trained. So our lab technicians work with these dentists. So the dentists may have a lab technician for their CO dentistry, but their biorejuvenation cases, they use one of our biorejuvenation lab technicians. So we're able to keep up with what they're doing. And 90% of our doctors are doing this on a regular basis.
Yeah, and I don't know, I see that Dr. John Sweeney is on. Dr.
Hey, John.
Sweeney says, absolutely best decision of my profession to take the residency of the Stewart Center. I don't know if you want to share a little bit about his story.
John Sweeney, first of all, is an incredible human being. Whether he's a dentist or an astronaut or a waiter at Starbucks, he is an amazing human being. John took our course and went back, sold his very, very profitable practice, very busy practice in North Carolina, and he opened up a biorejuvenation dental practice called Focus.
Yeah.
It's amazing. One operatory. So when a patient comes in, all the focus is on that operatory and that patient. And that's all he's doing now. Yeah. And he is loving life like he's never enjoyed it before. And John, I'm proud to say, is on our faculty as well. Yeah. He's actually a faculty in training right now. And John's going to do great things. You'll be hearing a lot more from him. But this is something that we know our graduates are doing, because all I got to do is pick up a phone call to our lab technicians and say, hey, who's sending you cases? Yeah. And they, they let us know. So we know that 90% of our graduates are doing this on a regular basis. And when Craig and I founded this, one of the things that was really important to us is that the patients that go through the doctors that go through our residency program are required to restore at least one patient when they go through the program. So not only are they learning it, but they actually do it. None of the other courses out there, you can go through any of the other courses and never practice any of it when you get back to your practice. You can just say, hey, I've been through this course or that course. Doesn't mean that you're using it, that you're practicing it. Our residents at the very least have to do one case. Yeah. Most of them do at least 2 cases when they go through the residency program, and then they just explode after that. Yeah. So we've had one resident, Dr. Julie Babcock, did through her program with us. She did, I think, almost 6 cases during her residency. So the fee we charge is not cheap. It's $37,500, and that's going to go up. That's going to go up every year, because we have our doctors tell us all the time we're not charging enough. And the more we see how this one-on-one type of teaching works, that you are face-to-face. This is, there's some things that work great online that you can learn. If I want to learn how to layer a composite for a class 4, number 8, class 4 fracture, I can watch an online program and I'll probably learn a lot. This is something you cannot do online. It would be criminal to try to teach this online. This has to be done hand to hand, face to face, one-on-one. And that's what our doctors love about it, is that when you come to the Schuster Center, or the Schuster Center, I was telling Alexander earlier, when I see SC, I think Schuster Center because I was a mentor there for years and years. Again, my good friend Mike Schuster. When you come to the Stewart Center, you're going to get one-on-one attention, hands-on. And when you leave, I'm a phone call away. Craig's a phone call away. Dr. John Sweeney is a phone call away. Our airway expert, Mary Burns, pick up the phone. We're available, and we're always going to be that way. My dad was a builder. He built 2 houses a year his entire career. He did not get into the mass quantities, and that's the way it's going to be. As long as I'm the CEO of this company, it's going to be small, hands-on, one-on-one. You will have a group and a peer group that supports you, and a group that you can rely on for information, for encouragement. And, for me, that's what it's all about. Coming from a big family with 7 kids and being very close, it's all about relationships and trust, and doing what you say you're going to do. And that's what we do with our residents. I'm there 24/7 for any of them.
Great. Awesome. Well, that's all the time that we have. But of course, if you want to learn more, you can visit us at thestewartcenter.com. Feel free to email our executive director directly at Kathy@thestewartcenter.com. And if you have any more questions, feel free to direct message us on Instagram, Facebook, wherever. And we, of course, will get back to you and answer any questions that you have. Do you have any last minute things?
I just
that you want to say?
Thank you guys that are watching this, and those that watch it when it's tape delayed, in the next several weeks. It's a privilege and honor, and I'm always humbled by the fact that doctors of the quality that I meet actually, will listen to me and give some merit to my experience. And I'm in this for you guys. I want you all to succeed. So just thank you for being here tonight. And we're just a phone call away. So give us a call, and have a great evening.
All right. Bye, guys. Thank
Bye-bye.
you.
Thanks.